So, good evening, Damien. My name is Carol, and I'll be your nurse today. I'm here to perform an examination on your lungs and thorax, just to see how you're doing. Okay. All right. I will be tell you from before. I will be touching you and just to, make sure everything is gonna okay with you. Okay. Is that okay with you?
That's okay.
All right, fine. So first, we will begin with our inspection part of the examination, where we're gonna inspect the chest. We're looking for his breathing. We have to look anterior and the posterior, right? He doesn't want to take his shirt off, so we're just gonna pretend, right? But I can see here from where I'm standing that his rate of breathing is okay. He's not using any accessory muscles. He doesn't look like he's struggling to breathe. He's not short of breath. His nails aren't blue, so he has great cap refill. He doesn't have any clubbing to his fingers. His chest doesn't appear barrel shaped, right? Which is I guess some COPDs would look like that. So everything looks normal and looks symmetrical from the front and back, right? Then we'll the next part of our exam is that we're gonna go into our palpation part of the video. We'll start with palpating his posterior chest, our back or thorax first, and then we'll go to his chest next. Okay, so we're gonna palpate his back.
I'll be done.
Yeah. Yeah, you have to turn around. Okay, so we're gonna palpate his back to see if there's any lumps or any bumps in his back, so to speak. We're also looking at his skin to make sure there's no lesions or discoloration. Everything looks fine here. Then we're gonna palpate and ask him to repeat after me. You're gonna repeat and say 99. I'm gonna use the palmar aspect of my hand to feel if there is any tactile fremitus, basically, or any vibration, so to speak, right? If there's any sound coming through, that would be normal, right? So you're gonna repeat after me. You're gonna say 99.
99.
So over the scapula, you're not gonna hear anything, right? Because it's a major muscle, so it's okay to not hear anything over there, right? Or any vibration, I should say. So just say 99 for me.
99.
All right.
99.
Ready?
99. 99. 99.
Okay.
99.
All right. So that sounds fine, right? Then we're gonna go and we have to after we palpate it, everything seems fine. Then we have to percuss his back, right? We're gonna percuss his back to the point. We're gonna percuss his back to, and it's to go from resonant, right, to dull. And with that also, I'm gonna find where it's either gonna be, I guess, 3 to 5 centimeters, and I'm gonna look for where it goes from resonance to dull, and then we're gonna check for his diaphragmatic fragment excursion from there, right? So I'm going to use. Wait, I'm gonna switch sides. I'm gonna use find his main on his back, right? I'm gonna find, and then we're gonna percuss, right? Ready? Sorry. I'm sorry. Okay, so there I hear it's dull, right? The sound changes. Okay, so it goes from dull here. So now I have to find out where it's resonant here. So here, still dull, dull. Here, resonance there. Right, so it's about 3 centimeters. So I'm gonna, maybe you're gonna have to stand up a little bit. Right, and then inhale, exhale, inhale again, Exhale again. Okay, so there we just measured his diaphragmatic excursion basically, and it's the amount that his diaphragm has to expand in order to let in air as well too. Okay, now we're gonna go into the auscultation part of the examination, right? We're all gonna auscultate first. We're gonna listen to see if there's any crackles or wheezing in the lungs, right? So we're gonna use our stethoscope. We're gonna use our diaphragm of a stethoscope. Okay. So whenever you feel the stethoscope touch your back, just take a deep breath for me. We're gonna start from his upper scapularis. Take a deep breath. Deep breath. Deep breath. So in his back, it's okay to hear you're gonna hear tracheal sounds to the upper aspect. I don't hear any wheezing. No crackles. And it sounds symmetrical on both sides as well. Okay. Right. Now we're gonna go, being that I'm here already, I'll just finish the auscultation part of the exam. So I'm gonna have him do the whisper test. So you're just gonna say whisper 1, 2, 3, right? Well, don't say it. You're just gonna, I guess, say it so I can hear. What's that? You mumble it? No, don't mumble it. Just whisper. All right, ready? Okay. Excellent. So even though I see his lip moving, I don't hear anything, so that's perfectly okay as well too. Now we're gonna have him do the E test, so to speak, where he's gonna say EE, right? And his EE should be able, when he says EE, I should be able to hear him say EE. If it changes and he says AE, it could notify me that maybe he has some pneumonia or a consolidation in the lungs. Ready? So you're gonna say EE. Oh, I hear it. All right, that's amazing. So I heard everything. There's no sign of there's no sound of crackles or wheezing. I was able to hear him say EE. There wasn't any AA sounds, so there's no consolidation to the lungs. He's negative for crackles as well, and I didn't hear any wheezing either. All right. So now whatever we do on the posterior aspect of the chest, now we're gonna do to the anterior aspect of the chest. So I'm gonna ask Damien to turn around. Look happy. Last time Professor was like no stress. Okay, ready. So now we're gonna go into the first we're gonna go into, once again we can look at the chest, but I did that before. We're always looking for a symmetry of the rise and fall of his chest, his work of breathing, if he's having a shortness of breath or difficulty breathing, which he does not have, right? Then we're gonna go into we're gonna palpate his chest. So we're gonna do the same technique where we this part. So ready again. Okay, so that's fine, right? I didn't hear any all the sounds are, I guess, resonance was where I didn't hear any dull sounds, or when I hear dull sounds it's by the heart, so to speak, right? So that's completely okay. Then we're gonna go into the Then we're going to go into the auscultation part of his anterior chest. So once again, I'm going to take the stethoscope, right? And whenever you feel the stethoscope, just take a deep breath. I'm going to start over his scapular area. So take a deep breath. So we always do the ladder method, right? Because we have to check one side versus another, right? We're always checking for symmetry of sounds, right? Making sure there's no changes, right? Another thing that I forgot to mention is that when we're also palpating, we're asking Damien if he had any tenderness to his chest, right? Or maybe he has some trauma, right, which he did not indicate, so I don't think he has any either. Also, in women who are large busted, right, I would ask them when I was doing the auscultation part of the exam to lift up the breast, for lack of better words, in order for me to listen to the sound of the lungs, right? I didn't hear any wheezing to his anterior chest, nor did I hear any crackles. Okay, and then also we do the whisper test once again. So whisper 1, 2, 3.
Whisper 1, 2, 3.
Mm-hmm.
Whisper 1, 2, 3. 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 Whisper 1, 2, 3.
Okay. All right, very good. I didn't hear anything. Right, so there's no consolidation. Then we're gonna go into the EE examination. All right. So could you please say EE?
E-E. 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 E-E.
All right. So I was able to hear him say EE. It did not change to AA, so I know he has no consolidation to his lungs, right? And also, and I think that concludes my examination for Damien's thorax and lungs. Thank you.